Welcome to Native Talk Arizona, presented by Native Health and KRDP 90.7 FM. I'm host Lanasha Puwadi. Later in the show, I'll chat with Dr. Yvette Brown-Shirley, a neurologist at the Brain Injury and Sports Neurology at the Barrow Neurological Institute. And Patty Talahongva and Heather Cabot will chat with us about their upcoming book, Indian School Road. On the phone with me is Erica Leffler, who is with the Carl T. Hayden Veterans Administration Medical Center in Phoenix, and she will tell us about the available programs and upcoming events with the Phoenix VA. Hello, Erica. It's an honor to have you on our show today.
Hi there. Yes, I'm happy to be here. Thank you for having me as a guest.
Absolutely. And before we get started, can you tell us a little bit about yourself?
Absolutely. So yes, my name is Erica Leffler. I'm a licensed clinical social worker here at the Phoenix VA. I'm the community mental health liaison, which essentially means that I serve as sort of an interface in representation for our mental health programs here at the VA. I work with our community partners to collaborate in terms of veterans' needs and what's, again, the resources that are available in serving the veteran population. I've been here at the Phoenix VA for a little over 5 years now.
Erica, can you let us know what services are available for Native Americans in the Metro Phoenix area?
So I think one of the most exciting announcements to share with American Indian and Alaska Native veterans is the co-payment exemption. American Indians and Alaska Native veterans may be eligible for co-payment exemption and reimbursement of co-pays for healthcare and all urgent healthcare visits. American Indian and Alaska Native veterans can learn about eligibility and how to submit official tribal documentation at www.va.gov/healthcare/copay-rates or by calling the 1-800-MY-VA-411 number.
Erica, I know the Phoenix VA is very involved with the community. Can you guys let us know what upcoming events do you have?
Yeah, certainly. We're really excited about a couple of events. You know, with regard to Native populations specifically, the Phoenix VA is planning several events locally in celebration of National Native American and Alaska Native Heritage Month for the month of November. So with that, we'll kick it off with the display of 22 tribal flags in the lobby of our main campus. From the beginning of November through the end, there will also be an opening ceremony for the month, which will include cultural performances and postings of those colors. November 6th, we'll be hosting a turkey story. Veterans Day will be honored through a video display of the contributions in the war, and Native American food trucks perhaps might be on site. So these are just a couple of examples. We're still sort of waiting for authorization or I guess verification that these events will take place. And of course, more information about these events can be found on Facebook, Twitter, and Instagram. But primarily, I'm here to talk about the Mental Health Summit scheduled for October 19th. So this will be held at our 32nd Street location from 8 in the morning until 4:30. We'll have the event both virtual and in person, and registration can be achieved through the Eventbrite.
Oh, wow. That sounds like you guys have a lot of exciting events lined up for the month of November. And also, as you mentioned, the Mental Health Summit coming up. Can you tell us more about the Mental Health Summit? What are the topics? And just a lot of information regarding the summit.
Yes, absolutely. So we're really excited. This is going to be essentially a hybrid model. In the years since COVID, we've partnered with our Northern Arizona VA and our Southern Arizona VA to offer a virtual summit. You know, obviously prior to COVID, we would gather in person, and each individual VA would host their own summit because it is a national initiative. So again, the morning session will be held with our 3 VAs. It's going to be offered virtually. We'll have topics such as suicide prevention among veterans. We'll have topics of MDMA. We'll have topics of ECT. You know, again, primarily the focus is the idea of dignity in mental health, right? And so how do we continue to offer and support veterans in regards to these mental health needs while maintaining that level of dignity? In addition to the ones that I mentioned, We'll offer an overview of tribal services with our social worker, Dino Haley. We'll be talking about the Compact Act. We'll have guests from Medicare and Social Security. We'll have the Vet Center representing. These are all for the on-site program. So again, if veterans or family members or community members and partners are interested in participating in person, they can register via the Eventbrite. Lunch will be provided. There is a limited number of people, so please register early. So just a little bit more about the actual summit. It's an annual event that brings together key stakeholders, veterans, clinicians, and representatives from community healthcare, academic, and governmental programs. The idea is that we share the goal of promoting the dignity of service members, veterans, and their families. For many veterans, the hardest step is knowing how and where to obtain help. Our vision with the Mental Health Summit here at the VA is that all stakeholders have knowledge of supportive services and effective treatments that are critical to the mental health recovery and wellness. Our mission is to ensure that service members, veterans, and families with mental health needs receive prompt, personal, and effective attention within community collaboration that promotes wellness and recovery and facilitates early recognition and coordinated interventions. So again, in partnership with Prescott and Tucson, we are offering these sessions virtually via Zoom from 8 to 12. And for individuals who want to come check us out in person, our 32nd Street outpatient clinic is hosting the afternoon. So that will be comprised of free lunch, networking, mini breakout sessions, and resource tables.
Oh, wow. That sounds like a pretty exciting event. And Erica, just to confirm, is this event open to the community?
Mm-hmm. It is, absolutely. So we're not limiting registration for the virtual session in the morning. There's many people that are interested in learning more about what the VA is doing. We have some special announcements, and again, discussions on the services that are offered, in mental health. Those numbers are not limited. Please register and attend the virtual session. Anybody, community partners, veterans, family members. We've even asked if active duty would be interested. Clinicians, again, key stakeholders that are interested in furthering the mission of the VA. And for the afternoon, again, anybody is welcome. Community partners, we have vendors from different hospitals and organizations that support veteran services, veterans themselves, clinicians. This is really just about a partnership and really the landscape that we live in and how we can all work together to serve veterans and meet their mental health needs.
Do you anticipate that you will get more of a attendance since it is a hybrid event?
We're certainly hoping so. The numbers have been sort of limited in the last couple of years. I don't have numbers from when we held the event in person. I know that I attended, as a clinician several years ago when the previous mental health liaison was the facilitator of it, and it was a big success. I think this year we're trying this hybrid model. We've seen other VAs use it, especially this last year, and have a tremendous amount of success. It was a lot of fun for them to organize. I think moving forward, given the data that we collect in terms of who did attend and what feedback was provided, that we may consider that this is the way that we do it moving forward, right? Because we want to make sure that folks have access.
Oh, yes, definitely. Thank you for sharing all of that resources, Erica. And can you let us know how can someone reach out or contact their tribal liaison?
Absolutely. So there are a couple of different ways. Our Rural Health Coordinator, Tracy Shondine, can be contacted at shondine.tracy@va.gov. Dino Haley from the Dene Tribe is our Phoenix VA Healthcare System licensed master's degree social worker. He's currently in our substance use disorder treatment program. He's also a certified Dene medicine man with the Dene Medicine Men's Association. He can be contacted at dino.haley@va.gov. We have an individual from the Southwest Region Tribal Government Relations Specialist. It's the VA Office of Tribal Government Relations. She can be emailed at lorraine.pawicki@va.gov. And then we have Peter S. Vicaire, who's a VA Advisory Committee on Tribal and Indian Affairs Committee Manager, and his email again is peter.vicaire@va.gov. So lots of resources, lots of people out here to connect with and, guide folks in regards to how to access any sort of, Native American or Alaska Native veteran benefits and if they have questions.
And Erica, how can someone learn more about the Mental Health Summit and all of the exciting events that you guys have planned for the month of November?
So I think the best way to do that is make sure that you're registered to maybe become part of the government listserv, be part of our email groups. And also, any of this information can be found on our VA website, our local VA website, any of our social media accounts, Facebook, Twitter, Instagram. There's so much coming up. Just stay tuned for more details.
Perfect. Well, I would like to thank you, Erica, for taking time out to talk to us today to tell us more about the exciting mental health summit that you have coming up and also the other events you guys have planned for the month of November.
Well, I'm, again, happy to be here. Thank you so much for the opportunity to speak about this event and other events that are coming up. We really just want to reiterate that we're here for the veteran population, for the veteran community, and I want to say thank you for your excitement, and I really love the responses that you've given me, and we're motivated again to just really offer a great service.
Coming up, I'll talk with Dr. Yvette Brown-Shirley. Support for KRDP 90.7 FM comes in part from Native Health with 2 locations in Phoenix, 4041 North Central Avenue, Building C, near the corner of Central Avenue and Indian School Road, and at 2423 West Dunlap Avenue. Native Health is also located in Mesa at 777 West Southern Avenue, near the corner of Southern Avenue and Extension Road. Native Health provides primary medical, dental, behavioral health, WIC, and wellness services for the urban Native American community. For more information, call 602-279-5262 or visit our webpage at nativehealthphoenix.org. Welcome back to Native Talk Arizona, presented by Native Health and KRDP 90.7 FM. I'm host Lanasha Puwadi. In the studio is Dr. Yvette Brown-Shirley, a neurologist at the Brain and Injury and Sports Neurology at Barrow Neurological Institute. She is the only Native American neurologist in Arizona. Hello, Dr. Brown-Shirley. It's an honor to have you on our show today.
Hi, thank you for having me.
And before we get started, can you tell us a little bit about yourself, your journey, and your background?
Yes. So my name is Yvette Brown-Shirley. She Yvette Brown Unisha, Torichin Inishla. My Dishkijin Bashichin, Tohiglini Dashache, Tachini Dashanella. So I'm originally from Flagstaff, Arizona. That's where I was born and raised. And I just introduced myself in my native language, so Navajo. I saw that you were Navajo, and I think we're related in a couple of ways. So I was born off the reservation, and that's where I grew up, and I went to college at Arizona State, and then I did my medical school in New Mexico, and then I came back here to do my training at Phoenix Children's Hospital in pediatric neurology. And then I finished off with some subspecialization in sports neurology and traumatic brain injury.
Oh, wow, that's so exciting. And how did you first get interested in medicine and specifically neurology?
Yeah, I had a atypical route to medicine. When I was growing up, it was really just trying to find what I was good at and what I loved. So that ended up being like science, math, even art. So I went to University of Arizona to study architecture, right? So architecture, I thought that was going to be my thing. But then I realized maybe not so much. So then I actually transferred to Arizona State, and I majored in math and American Indian Studies, trying to figure out what I wanted to do with my life. And then I ended up talking to one of my advisors, and I was like, hey, what about medicine? Like, what about like a physician assistant? He was the one that actually told me that I should dream bigger and actually become a physician. So that just kind of stayed in my head, and then I went into the pre-medicine field after that.
Where are you practicing now?
I practice at Barrow Brain Injury and Sports Neurology Center.
What services do they provide?
Yeah, so Barrow is actually one of the nation's top neurological and neurosurgical facilities that specializes in treating disorders of the brain and spine. So that would be anything from epilepsy to Parkinson's disorder, so movement disorders, to Alzheimer's, which is like a memory disorder, to what I treat is concussion. So concussion is just a type of traumatic brain injury. So we see athletes and non-athletes who have brain injuries.
Oh, wow. And then I know you just mentioned that you primarily specialize in concussion. Can you tell us more about that, or sports head injuries?
Yeah, so, I think it was just more of an interesting story about how it's been an evolution of concussion. I mean, even when I was going to school here, in northern Arizona, back when I was growing up, there wasn't really concussion. There wasn't, the talk of concussion or even to go see your doctor for a concussion or treatment. You kind of just shook it off, and you just get back in and play your sport. And so that's been changing. So that's what's been fantastic about just awareness of concussion and the repercussions of concussion. And so that's really what I talk about with a lot of my patients is a lot of comparing, contrasting the evolution of concussion. So it's talking to the parents, like what's been different about when they were growing up and right now treating their children about concussion and head injuries and what we can do to help them.
And what precautions should someone take when playing sports?
Yeah, well, we got to remember that there's a lot of benefits to playing sports and being physically active. So that most times it is outweighing the cons, and the risks. And there's always going to be risks when you play sport or even when you leave your house.
Yes.
Right? And so there's going to be ways to make sure that you put your safety first. So one is going to be that there's no way to completely be in a risk-free sport. So ensuring that you have safety and protective equipment that fits you, that's going to be one way to help just keep yourself safe while you're playing some sports. Learning proper technique when you're playing your sport, like for example, like heading techniques in soccer or, tackling techniques in football. Yep. And then if there's any concern for any head injury, then that's when we need to, educate our athletes that if you feel something, then tell someone. If you see someone that isn't feeling well, doesn't look well, then tell somebody, tell your parents, tell your friends, tell your coach, athletic directors, and just letting them know that we need to evaluate them for a brain injury.
And on that topic, when should someone want to look into consulting a doctor?
Ideally, once you notice the signs of symptoms of a concussion or a brain injury, you want to see someone, even if it's mild symptoms, within 1 to 2 days to just get evaluation, to get some education about what to look out for, what's, and the typical trajectory of the recovery from a concussion and head injury.
What advice do you have for children wanting to play sports, like young children?
Yeah, so I'm telling the children and their parents that it's wonderful to be physically active, right? We need to remember that. But there are ways to make it safe, right? So that's going to be something, too, to know the rules and regulations of your sport. Those are in place to make you safe. And so that's going to be very important.
What advice do you have for children wanting to play sports?
Yeah, like I had mentioned, it's wonderful to be part of a team and to be physically active. There's a lot of benefits to being a student athlete. And so injuries can happen in any sport. We have to remember that. And we are, like me, we are finding ways to make sports safer. Yes. So don't be afraid. Please take part in sports.
Would you recommend, because I have a little 1-year-old and he falls everywhere, so we got him like a little cushion helmet. He doesn't keep it on, but it sometimes protects his head at times.
Yes. No, I totally get you. I have an almost 2-year-old, and yes. So in that age range, when they're starting to learn to walk, like less than like under 4, that's when they're unstable. So that's when they're at risk of having falls. So yeah, so making sure you're watching them. They're not, you're attending to them, supervised, playtime, and also just making sure if that makes you feel better, like those little helmets, then so be it, right? A little cushion. And the same thing can be said for our elderly, right? So over 65, again, the risk of having falls is another thing we have to watch out for our elderly. So that's why, making sure we hold on to their arms when they're trying to walk down unstable, surfaces, stairs, that'll be helpful for them too. And also just helping them to become aware of the risks as we get older, especially over 65, the risks of falling and that leading to some bleeding in the brain, which, is scary. Yes.
And when would you know to consult a doctor if you are working with, let's say, a child or an elderly who can't really communicate that something, they're feeling dizzy or like their head is hurting?
So you're the best person to know them, right? So you will know them because we spend so much time with them as their parents or, as their caregivers as they get older. So if they start acting different, especially after a fall or something, you just got to be on high alert and just watch them and just see, are they acting like their typical selves? Are they falling more? Are they more confused? And those would all be signs and symptoms to be like, okay, maybe I need to see either the doctor, like a primary care physician, or if you're just really worried and you're scared, then that's when, that would be the concern for maybe an emergency department evaluation. Okay.
And Dr. Brown-Shirley, can you share with us one of your favorite success stories where it could be somebody you worked with, or actually your story is actually a very successful story of how you started at Native Health as an intern. Can you kind of share with us your little background of that?
Yeah, so I used to be a volunteer here in my college years. I had learned what Native Health does for the community and still does wonderful things for our community. So I very much believe in what Native Health does. And they have wonderful providers. I was just listening to Dr. Yazi's story, that had just played last week on the September 27th episode. And so it's just wonderful here to be part of this big family and what you guys do for the community. So I've always been invested in what Native Health does. Even, from college, I was a volunteer here, just folding brochures, do anything small that I could do, right? Resident, I came back when I was, after I became a doctor, I came back and I was like, what can I do? So it was really just, again, having this extra pair of hands, doing some educational classes. And still, I want to do the same thing here in the state of Arizona, is just providing more care and elevating the care of our people so that we can provide top-notch care to our people and elevate the care of our relatives, right, and take care of them in the best way we can, which is, I think, with Barrow, we are top-notch. We do great things, and I work with wonderful people who care about giving back.
Oh, yes, definitely. And can you give us some advice for maybe someone that is graduating high school or maybe that is in college right now who is wanting to follow in that same career path of becoming a provider or a neurologist as well?
Yeah, just find out what you love to do. And once you do that, that'll be the easier part, because then you'll get good grades, right? You have to have good grades. You have to be a successful college student. And then there are typical ways to go through, like pre-medicine. That could be the medicine route. But I was a non-traditional student. I took the science courses that were needed for medical school, but I chose math and American Indian Studies. I just knew that was my passion. That's what I loved and I was good at. So I was like, okay. And so that worked out for me. And so that's the way I went about it. And you can ask, 10 different Native American doctors how they got into medicine, and we will all be different with similarities, but we're all going to have our nuances about how we came into medicine.
Oh, yes, definitely. And you can find more information about Barrow Neurological Institute by visiting their website at barrowneuro.org/concussion. I would like to thank you, Dr. Brown-Shirley, for coming in today to give us all of this great information about all the great work you're doing in the community and just coming back to Native Health and just giving us an update.
Yes, thank you for having me.
Up next, I'll chat with Patty Talahongva and Heather Cabot. Support for KRDP 90.7 FM comes in part from Native Health, with 2 locations in Phoenix, 4041 North Central Avenue, Building C, near the corner of Central Avenue and Indian School Road, and at 2423 West Dunlap Avenue. Native Health is also located in Mesa at 777 West Southern Avenue, near the corner of Southern Avenue and Extension Road. Native Health's patient enrollment specialist can help you enroll, renew, or update your access information. This can be done in person, on the phone, or Zoom, days, nights, or weekends. It's fast, easy, and can make a difference in keeping your healthcare coverage. For more information, call 602-285-9492. Welcome back to Native Talk Arizona, presented by Native Health and KRDP 90.7 FM. I'm host Lanasha Puwadi. Patty Talahongva and Heather Cabot is here to tell us more about Indian School Road. They are co-authors of a new book and to tell us more about the Indian School Visitor Center here in Phoenix. Hello, Patty and Heather. It's an honor to have you guys here with us today.
Hi, Lanasha. Thanks so much for having us on Native Talk Arizona, and thank you for all the good work that Native Health does in our community.
Thank you. And Heather?
Thank you so much for having us. I'm thrilled. I grew up in Phoenix, so it's always a pleasure for me to talk with people back in my home city and state.
Perfect. Well, before we get started, can you both tell us a little bit about yourselves, your journey, and your backgrounds?
Oh, that's a great question because, when Heather and I met, we had so much in common. We were both like, how did we not know each other before this? So and then we just keep finding these commonalities as we've gotten to know each other. But, I worked back in 2012 with Native American Connections, and we renovated the former elementary school at the old Phoenix Indian School here in downtown Phoenix. And Native Health is right across the street from what's now known, as Steele Indian School Park. So I had worked there, and we opened up the Phoenix Indian School Visitor Center in 2017. And in that process, I also started helping out with the Heard Museum's boarding school exhibit. They were going to renovate it, update it, and we did that in about 2017-18. So all of this work combined actually is what led Heather to find me and my work. So I'll just say that, both of us are journalists, both of us are broadcast journalists, and she, like she said, grew up here in Phoenix, and she went to Sunny Slope High School, graduated from there when Phoenix Indian School was still open. So I'll let you take over from that part and tell a little bit about your background, Heather.
Sure. So I have to say I didn't even realize that the school was still open when I was a student back in the late 80s. And I actually didn't find out about it until a few years ago when I had just finished my third book, and I was thinking about what I might want to write about next. And I was home visiting my parents. And I started thinking about some of the stories that I'd heard about following the residential schools in Canada. And I realized, oh my goodness, I wonder if Phoenix Indian was one of those types of schools. And so amazingly, I ended up going to the Heard Museum and seeing Patty's exhibit, but didn't realize that she had actually worked on that until a professor at the University of Arizona introduced the two of us. And we met in February of 2022, and we've just been talking ever since. We decided to collaborate about 6 months after that on this book project. And for me, I've always been an investigative journalist, and this type of a project is incredibly. Not only is it important, but it involves, very deep research skills, but also combining that with oral histories that we are that we've been so honored to be able to take from various members of Patty's family and other alums of Phoenix Indian who we've met so far, and also descendants. And so this is a topic that both interests me from a social justice perspective, but also just from the perspective that I grew up in Arizona and didn't really know the history of the school. And I just felt like it was a story that needed to be told. And I'm so honored that Patty wanted to team up with me to share her family story. And we've just really enjoyed working together.
Oh, yes, definitely. I'm excited to learn more about the Indian School Road that you guys are both collaborating on. But to start off first, for our listeners who are not familiar with boarding schools, can you guys tell us why and when they started?
Sure. So the whole boarding school system was the idea of Henry Pratt, who was an officer in the Army in the late 1800s. And literally, his job in the Army was to kill Indians. Mm-hmm. They were trying to get rid of us so that white settlers could come in and create towns and, their businesses and whatnot. But he realized that there are too many of us and we're good at hiding, so he did the next thing, and that was to divide and conquer. Mm-hmm. So his idea was to take the kids out from the tribes, their villages, their clans, their families, and put them in these boarding schools and then raise them in the way white European Americans wanted us to be. So that meant a total erasure of our culture, our religions, our languages, everything. Because at these schools, we couldn't speak our languages, certainly couldn't practice our religions, and could have no cultural activities that we would normally have back home. And so, I mean, they changed everything. Our hairstyle, they cut the hair. The clothing, they took what, in those, again, in the late 1800s, the kids came in their traditional clothing, and they took them away from the kids, and they burned them. Because their mindset was, well, you'll never need those kinds of clothes today. And as I walked in here to Native Health today, I'm seeing everybody wearing their moccasins. And I told Susan, who brought me up here, I said, I feel left out. I should have been wearing my moccasins today. But can you imagine that they took those clothes and they burned them? And so everything was changed. Our language, our clothing, our culture, our religion, they tried to change that. Even our food. So this Carlisle Indian Industrial School was the first of the federal government boarding schools in the U.S. And then from that, it spread across the country. Phoenix Indian School was one of the largest in the Southwest, and it opened in 1891, and it closed in 1990. So it was 99 years of government education. And government never does anything right. So these schools were not true educational institutions. They were meant to create a cheap workforce. Raise these kids, show them skills for manual labor jobs. They weren't training us to go to college. They weren't saying, hey, you can become your own business person, operate your own, company, or be a lawyer or a doctor or whatever. No, they were teaching our boys how to do bricklaying or painting or printing or working on farm equipment or farming, and farming from that European American perspective and not our own traditional ways of farming. So the girls were being raised and trained to work in other people's homes. So this whole boarding school history, the reason why people like Heather doesn't know about this, and so many people that we meet who aren't Native, they don't know about this history because it's not taught in our schools. And that is a huge gap of information. Where are we today because of what has happened to us in the last 150 years? So so that's the history of the boarding school. There were a number of schools. The actual number is escaping me right now, but they were primarily located in the Midwest and the Southwest, but there were boarding schools on the East Coast as well. And again, my work with the Hurt Museum, I encourage everyone to get down there and see the boarding school exhibit. And if you can't, for whatever reason, you can go online or download their app, and you can take a tour of the boarding school exhibit. And I actually narrate that too. So, yes. So that's a brief history. Go ahead, Heather.
And I would just also add that for people who are listening, and I have a feeling this audience probably already knows this, but I will say it anyway, when the Biden administration appointed Secretary Deb Haaland to head the Department of Interior, that was the first time that the United States launched any kind of examination or look back at the federal boarding school system. And so after she was appointed, she launched an investigation, and an initial report was released in the spring of 2022. And the investigation continues looking back. We know that in Canada, which also had a residential school system, they've had a Truth and Reconciliation Commission there for close to, I believe, 2 decades. So we're really far behind here in the U.S. in terms of looking back at these schools. I believe that the latest tally, and they are still identifying schools that were both founded by the federal government, but also founded by the government and then outsourced to churches to run. I believe the latest tally is about 523. And if you're interested in learning more about the U.S. boarding school system nationally, both the New York Times and the Washington Post have written pretty extensive stories about the system and the U.S. inquiry through the Department of Interior and sort of the latest of where we stand on that. There's so much, as Patty and I will probably talk about a little bit more in this interview, but there's so much we don't know because the records and the documents were not well kept. Most of them are not digitized, and they're located in all kinds of archives and libraries all over the country. And that's part of the accounting that's happening right now through the Department of Interior, is actually just locating those records and figuring out what still exists so that they can try to piece together what the history actually was. They don't even have an accurate tally of how many students actually went to the boarding schools because the record keeping was so shoddy.
And for an example, we've been looking for my grandmother, who we know went to Phoenix Indian School, mm-hmm. but she went at a time when they didn't have, they were assigned first names, mm-hmm. but sometimes they would use their Hopi names as their last name. And good luck trying to figure out how they spell those Hopi names because, European Americans heard the Hopi word and then they made it sound like what they thought. It's so funny to see these records. We did find her eventually.
Oh, wow.
And the spelling, her Hopi name is Talahongva, and they spelled it Cooche. Just something just so far off. Like, I read it and went, what the heck? And I had to cross-reference her with other people I knew she went to school with. Mm-hmm. And then we were able to pinpoint, okay, this is her. And then we saw some other references of her using the letter C as her middle name. So, that's just one example. So, yes, the records are all over. We've been to Washington, D.C., to the National Archives. Mm-hmm. And we've been to Paris, California for archival research there. We've been to Connecticut on an offshoot research trip. And Heather, you went to one more state.
Well, I was in Cheyenne, Wyoming, looking at the personal papers of one of the first national superintendents of Indian schools who made a number of visits to Phoenix Indian at the turn of the 20th century. And we'll be writing about her in the book. And also to Yale University in Connecticut, New Haven, which also has a collection of papers that belong to one of the very first superintendents of Phoenix Indian School. And so there are many, many more places that we still have to visit. And as I said before, most of these records are not digitized. So literally, Patty and I are going through these boxes of these records that are basically yellow, falling apart. There's
moldy,
mold, there's dust,
dusty.
It's like looking for a needle in a haystack. That's essentially what we're doing. We're looking for clues to the past, and none of them are really organized very well. So,
and they're general descriptions,
like detectives.
Yes, and
yeah, exactly.
And you have to handle these archives very carefully. Mm-hmm. You have to take a class to get your card to be an archivist. And so you're bending over because they won't let you hold the paper up to the light. They don't want any light to damage it. And so you're bending over the whole time. And then you're smelling old, musty documents, good grief. My nose started running, and I was like, okay, I have no tissue. I had to get up and go all the way down the hallway to the bathroom. And so I learned to bring cough drops, throat lozenges, just to help keep my throat and my sinuses clear as I was bending over. And then you're bent over for a long hours. I mean, we spent 4 days at the Paris Archives in California. And at night, you just had to stretch and lean back because physically you're just cramped. And then mentally and emotionally, for me, this is personal. I'm looking at my family's documents, and what I'm finding is so sad. And so, Heather looks up, and I'm over here crying, and I tell her, I just need a minute. I just need a minute because it's hard to process.
Oh yeah, I definitely understand that. I can't imagine how that would be going through all of those materials, and it's so amazing how you guys both are really kind of digging in deep and trying to find all of these histories and bringing it back and sharing it with everyone, which actually goes on to my next question. So all of your research that you guys are all doing, how is that going into the book that you guys are writing?
Well, we have a specific look. I mean, it's we need to let the listeners know too that this is not a personal narrative. Mm-hmm. We're not writing a narrative book. We're writing a story. We're writing, and it's all factual based reporting, mm-hmm. but it's a narrative nonfiction story. So it will read like a novel. And so I'm looking at my family's history, and Heather's looking at the policies that were in place. So we're combining the two. What was happening in the country? What was happening at the federal level that then was affecting my family who went to Phoenix Indian? And so we're really looking at the outing program. And this outing system, again, that was a program designed to train a cheap workforce. And it was supposed to have ended in the 30s, but it didn't. It continued on in some fashion. So when I went to school at Phoenix Indian in 1978, they still had outing on Saturdays. And Indians, they just call it outing, right? So, and it was actually officially the name of the program. So it meant you would go out to work at a white person's home. And anybody...
And this is still happening.
Yes.
In 1990 when it closed.
So, but the historical records that we've found, people were writing to Phoenix Indian School and asking, can you send me an Indian boy who can make beds and clean rooms?
Oh, wow.
Ordering up servants, basically. So when I went to school, you would get an announcement on Saturday mornings in the dorm, and they would say, we have, so many people coming to pick up kids to go work in their homes. So sometimes you could put your name on a list, but quite often it was you had to go to the office and to say, I want that job. And so, I showed up one morning and I didn't know who she was. I didn't know where I was going. I didn't know how long I'd be gone. I got in the stranger's car and off we went. And, no one called my mom and said, hey, this person's picking up Patty to go work in her house. So it's that program that we're looking at and how that shaped Phoenix and that also how it shaped our families. And so we would love to hear, because there's lots of kids or lots of adults now who live in Phoenix, and they went to the Phoenix Indian School. They're probably remembering this. Maybe their kids have heard their stories about their family, their parents, grandparents going to work in other people's homes, and they may not have called it outing or the outing program, but they were hired to work in other people's homes on the weekends, and we'd love to hear from them. So can we give out our emails?
Yes.
Oh, good. So it's just Patty, Patty, at Indian School Road, and then it's Heather at indianschoolroad.com. So you can email us, and if this is resonating with you and you want to share your story, that just helps us build out, more of that time frame of what was happening at the school. So, yes, Heather, please add.
Yes, we want to hear from you. I was also going to say, please follow us at Indian School Road on Instagram, and you can also direct message us there as well, if you prefer that instead of email. But I would say for myself, I think what Patty's describing about the coerced labor of students at this school over close to a century was what I found to be one of the most disturbing aspects of Phoenix Indian, and also something that I did not know about. And yet, when I visited the campus, which is now the park, for the first time, looking out at how the city of Phoenix has grown up around where the school once was, it really struck me. And then when we went back and looked at some of the original records, and in particular the research of a man named Robert Trenner, who had done some amazing foundational research that we're basing some of our book on, he went back and looked at some of the original Phoenix City minutes before Arizona was even a state, where you had local stakeholders, the town fathers essentially of Phoenix, advocating for the school to be located where it was, because they wanted to create this underclass of workers for this new city of the West. And so that's one of the themes that we're going to be looking at. And also I'll say is, in addition to examining the role of, and the sort of the larger than life characters from Washington who had an impact on the policies being carried out in Arizona, we're also going to be looking at what was happening in Phoenix and Arizona itself, and who some of those characters were who were driving the decisions around what was happening with the school. And so there's actually, I really feel like three worlds that we're going to be taking our audience into. So it's into the world of Patty's family, but also into the world of what was happening in Phoenix and Arizona, and then of course in the halls of power of Washington. So it's really a pretty expansive story with lots of twists and turns and lots of drama and lots of suspense. And, I think it's going to be something that will really be captivating and page turning for people when it comes out. And we should say it's being published by Hachette Book Group, and it's imprint Legacy Lit. And if all goes to plan and Patty and I get the manuscript done, it will come out sometime in the spring of 2026.
It seems like a far off publishing date, but we're on deadline now, So
yes. Pretty soon, tomorrow is basically the end of 2023. So
don't remind me. This is no stress here, right, Heather?
Not at all. We got this.
Oh my goodness. Well, I would like to thank you both for sharing all of this great information. It sounds like this book is going to be very informative and really a great structure of telling Patty's family history with the Indian school, and also Heather, you looking deeper into like the policy. So I think this is going to be an amazing book that everyone is really going to enjoy, and it is going to be a page turner trying to finish the whole book. I'm pretty sure we're going to have individuals that are going to want to finish it the same day. But I would like to thank you both for your time today to tell us more about this amazing book you're creating. But can you guys let us know, how can our listeners find out more information about this book, and also share some information about the Phoenix Indian School Visitor Center on how they could do a visit here in Phoenix?
Well, so you can follow us on Instagram, and it is at Indian School Road. And the first posting that we have is my big fat face, my school photo. My bangs are in my face. I thought, I must not have had any money to get a haircut. But we've had, and please do follow us, because our goal is to have 1,000 followers by the end of the year. And we have a little more than 100 followers right now. So we could really use your
Well, we just got started. We just started. Say, if you want to follow also our research, one of the things we're trying to do with our Instagram is just let people inside how, our journey of all the things that we just told you about, how we're going about pulling all of the information together for this story and doing all of the research and reporting it and our adventures. So if you're interested in that and our partnership, please follow us on Indian School Road, because we're going to try to give you a bird's eye view of our work.
And then locally, if you want to take a tour of the Phoenix Indian School Visitor Center, you can call 602-648 9713. And that goes directly to the visitor center, and you can set up a time to go have a tour. And they even rent space there. So I'm very proud of what we did with that renovation of the building. And so I encourage everyone, you don't have to be a corporation to rent the room. You can have a family dinner there. So when I was working there that first May, we had lots of families whose kids were graduating from college, and they came back to have a family dinner, and their grandparents went to Phoenix Indian.
Oh, wow.
So it was like a full circle moment, because that was built as the elementary school, and those kids who went to school at that time were not encouraged to go to college. Mm-hmm. So it's just really great. It's a great asset in the community. And the number again is 602-648-9713. And I just want to say, Esquili, thank you so much for having us on your program. And yes, please follow us on Instagram. Email us, Patty, Patty, at indianschoolroad.com. And we'd love to hear from you. Esquili?
Thank you so much.
Thank you for listening to Native Talk Arizona, supported by Native Health and KRDP 90.7 FM. Audio editing by Javier Quiroga, and the executive producer is Susan Levy. And I'm host Lanasha Puwadi. We hope you tune in again next week. If you have any questions, please email us at nativetalkaz@radiophoenix.org.